So if you're considering supplements for cardiovascular disease, magnesium is the first one to talk about. Studies have shown magnesium deficiency contributes to all heart health problems, including high blood pressure and arrhythmia. Magnesium is calming and relaxing. It regulates our nervous system, helps with sleep and stress, prevents anxiety, nervousness, restlessness, and irritability. Then there's L-glycine, an amino acid which has shown clear anti-atherosclerotic and anti-inflammatory effects. So why not put these two together into one molecule of magnesium glycinate, which also has the highest known bioavailability compared to other magnesium salts. Magnesium is so successful because so many people experience the benefits within 1 or 2 days of starting magnesium glycinate, so they continue. And because 80% of the population is deficient, and if you'd apply a bell curve onto that 80% number, it shows that about 17% of that number are mildly deficient, about 66% of that number are moderately to severely deficient, and at the tail end of the bell curve, another 17% are the ones approaching depletion. These are the individuals that suffer from all kinds of magnesium deficiency symptoms combined, like constipation, headaches, migraines, spasms, chronic hamstring or IT band issues, muscle twitching, or chronic back pain. The RDA, the recommended daily amount for magnesium, is about 3 of my capsules per day. That is the dose that will cover your daily requirements. But if you're starting out deficient or even depleted, then 3 caps per day is not enough to provide the RDA and replenish deeper tissues. So anybody who is just starting to use magnesium for the first time, I suggest to use more magnesium glycinate initially. Luckily, our bodies have a perfect safety valve for too much magnesium. If you get too much, you will notice looser and looser bowel movements, which is when you should cut back to regular label dose. Always spread your daily total out over the course of the day. Once replenishment has been achieved, which is after the safety valve engaged, with further concerns about cardiovascular disease, I would finish your magnesium glycinate bottle at RDA dose and then switch to MTQ as your cardio maintenance product. And here's why. MTQ stands for magnesium, taurine, CoQ10. We already covered magnesium, so now we'll discuss L-taurine and CoQ10. Taurine is an amino acid that naturally occurs within the human body. It has very beneficial effects on insulin, insulin receptors, on obesity, muscle health, energy, sleep, brain function, and also on stress. If you would dissect the body and look for taurine, you'll find highest concentrations inside the heart muscle. So researchers were asking, what's it doing there? And they were able to find that it helps funnel magnesium and potassium deeper into the muscle cells. So these 2 minerals are hugely important for cellular health, hydration, electrical stability, and regularity and strength of muscle contraction of the heart. Taurine practically preloads the muscle cells. And what is good for the heart muscle works just as well for any other muscle of the body. Athletes love MTQ. They take it pre and post workout or pre and post competition. So CoQ10 in our product, we're using the active form, ubiquinol, is a natural antioxidant made in the body by the same enzyme that makes our cholesterol. CoQ10 helps keep the bad cholesterol, LDL, in its less sticky state, so less plaque. It supports muscle function, circulatory health, helps generate energy, and also protects the blood vessel walls, the inner lining of the blood vessels, against radicals, thus reducing inflammation inside the blood vessels. CoQ10 deficiency has been associated with cardiovascular problems including angina, arrhythmia, heart failure, high blood pressure, but also muscle pain. And those individuals that are using cholesterol-lowering drugs, so-called statin drugs, are at a particular risk of CoQ10 deficiency because the enzyme that these statin drugs block also produces our own CoQ10. So putting magnesium glycinate, taurine, and ubiquinol into one cardiovascular formula is a no-brainer. And here we have the composition of MTQ per capsule or per day. You see at full dose, 2 caps twice a day, you'd get 300 milligrams of magnesium, 1,500 milligrams of taurine, and 80 milligrams of active CoQ10 in the ubiquinol form. I usually recommend to take 2 caps with breakfast and 2 caps with dinner. And many of our customers still use the regular magnesium glycinate by itself at bedtime to help with general relaxation and sleep, if the safety valve allows it. Don't forget, if you're taking too much magnesium per day, your bowels will tell you. So after replenishment, you have to figure out what is your maintenance dose per day. Bowel function is the gauge for that. Next on the list are B-complex vitamins. Stress depletes us of B vitamins. Plus, our diet truly contains less and less Bs. Furthermore, these Bs are water soluble. They flush through us very quickly, and a regular B-complex supplement only works for about 60 to 90 minutes. You can actually see that because about 10 minutes after taking a B-complex, your urine turns brightly yellow, and which is the B2 already being excreted. And about 60 to 90 minutes later, your urine is clear again, or almost clear. So Pure Lab's bioactive B-complex contains all the Bs, first of all in their active form, and they are fully therapeutically dosed. You can think of a bioactive B as a charged battery ready to use, compared to regular B vitamins being empty batteries that still need charging or activation inside your body. But more importantly, it is the slow release formula which provides blood levels for 8 to 10 hours. And the proof is in the P, not the pudding. You take 2 caps of our B-complex in the morning and you will still pee yellow when you come home at night. Moving on to vitamin D3. D3 has received widespread attention for its potential role in preventing cardiovascular disease and even type 2 diabetes. There have been several studies suggesting that individuals with low blood levels of D3 have an increased risk of heart disease, stroke, hypertension, and diabetes. Stress also has an influence on our vitamin D levels. Studies showed vitamin D blood levels plummeted during times of acute stress. But this research was unable to show why. They were thinking that stress-induced inflammation was to blame, but they concluded that there would have to be other factors for this drop in D. So now the big question is vitamin D dosing. Health Canada still recommends 1,000 IUs per day for every Canadian. And I tried to compare our supplemental need to what our body would normally produce if we were to expose ourselves to sunlight. So there's 2 studies providing, sadly, conflicting information. The Oslo study in 2005 investigated vitamin D body production during a 30-minute full-body exposure to midday sun. They were able to show that the average body would produce an equivalent to consuming 10 to 25,000 IU of vitamin D3. And they compared blood levels after sun exposure to levels after taking supplements. And then there's the Boston trial, where they tested vitamin D skin production in the winter at noon in Boston, Massachusetts. And they distinguished different skin types and concluded it would take about an hour for average skin type 3 to make 1,000 IUs. But they didn't specify how much skin was exposed. So you see, there's really no way around testing your own blood levels while using a specific oral dose of vitamin D3 consistently. So all this said, I believe vitamin D3 testing should become part of mainstream medicine to help prevent cardiovascular disease and type 2 diabetes, for bone density maintenance, for better mood during the winter, and most importantly today, to boost our immune system during this pandemic. For anyone interested in this, please visit our YouTube channel under Pure Lab Vitamins. You will find a large number of videos, but look for vitamin D optimization and vitamin D and immune defense. So we're coming closer to the end. Please all take a deep breath, stay awake. Vitamin K is the umbrella name for a large group of vitamins with varying chain length and molecular features. First, we have to distinguish between vitamin K1 and K2. K1 is best known for its role in blood coagulation. K2 plays an essential role in the development and maintenance of our skeletons. And K2 again comes in a variety of subtypes from MK4 to MK13. More specifically, K2 manages calcium deposition into the bone matrix and keeps calcium from depositing into soft tissues like the blood vessels. In essence, vitamin K2 sends calcium to where it should go. And then within the group of K2s, specifically MK4 and MK7 are being used most commonly. And between those two, it's the MK7 that has the longer side chain, shows highest activity in humans, and has clearly better bioavailability and longer half-life in the blood compared to MK4. All Ks interact with the blood thinner warfarin, also known as Coumadin. But patients could still use K supplements with warfarin as long as your doctor is involved and you are able to maintain a stable K2 regime and then adjust the warfarin dose accordingly. Obviously, this has to be done with your doctor and in a very structured way. Good news is, all modern blood thinners like Pradaxa, Xarelto, or Eliquis are not affected by vitamin K at all. Today, these modern blood thinners are much more commonly prescribed because they don't require the blood work or patients' dietary compliance. They are much safer. We are launching our own vitamin K2 MK7 very soon. It's going to be a pure MK7 at 120 micrograms per VeggieCap, coming from Norway. It's a soy-free product, which is unique because most K2 products are made from natto, which is fermented soy. Ours is made from rose and geranium flower oils. It's non-GMO, but the key factor here with our product is the double micro-encapsulation of the dry material. You can imagine, K2 has a high binding affinity towards calcium and other minerals. So if you're using regular MK7 with a meal or with other mineral-containing supplements like bone builders or multis, it would actually bind to calcium already in the gastrointestinal tract, which would prevent absorption. The double microencapsulation we are using prevents that from happening, which means more of our MK7 can be absorbed into the blood and then do its job with the calcium while in blood circulation. So many people will ask me, why don't you combine K2 MK7 with vitamin D3? And you expect me to have a good answer for that, right? So we talked about vitamin D optimization, which can lead to higher daily doses of D3 requirements to meet your needs to reach a good blood level of vitamin D. And if you were to use a fixed combination product, you would consume also much higher amounts of K2 as well. Well, there are some practitioners who do recommend high doses of vitamin K2, especially the MK7 form, in specific conditions. But for the average Canadian who's consuming good amounts of green leafy vegetables in their diet, the 120 microgram per day dose should be enough. So finally, we have to talk about L-theanine, which is the calming ingredient of green tea. An average cup of green tea contains about 8 to 10 milligrams of L-theanine, which means our 250 milligram capsule is equivalent to 25 cups of green tea, just one capsule. Obviously, this capsule does not contain any caffeine or other tea components. The L-theanine is an amino acid, and only the pure L form promotes relaxation and is bioactive. There's also no known toxicity and no contraindications with any prescription meds with this supplement. It helps reduce nervousness and restlessness, but also increases focus during times of stress. So it's calming, but doesn't make us drowsy. Perfect daytime supplement. L-theanine inhibits the effects of stress hormones, epi and norepinephrine, while upregulating serotonin, dopamine, and GABA. So it does exactly the opposite of what stress does to us, and some people call it nature's antidote to stress. L-theanine also increases alpha brainwaves, hence the slogan, ride good brainwaves. And these brainwaves are only present while we are alert and relaxed. They also boost creativity and reduce depression. Many of us suffer from stress-induced sleep problems. We wake up in the early morning hours and our brain is revving with repetitive thoughts. L-theanine, even though it doesn't make you drowsy during the day, downregulates your overnight and subconscious stress levels, so we actually sleep through. There's also clear synergy for sleep when it's combined with magnesium glycinate at bedtime. So these are the 3 L-theanine products we carry, each one with a specific application. Our regular L-theanine 250 milligrams are meant for the average Joe or Joanne with just regular stress levels. You'd take 1 capsule when needed, morning, noon, or bedtime. We have our 200 milligram slow-release capsules, and those are meant for the more chronically stressed individual with more severe anxiety. This is meant to be taken on a regular basis to combat stress effects and to keep anxiety levels low, the regime can be adjusted to what you need. For example, 2 or 3 caps during the day if needed, and 1 or 2 at bedtime for sleep. And then we have our sugar-free chewables with 125 milligrams of L-theanine. And they are very fast acting, especially if you keep the chewed slush in your buccal pouch or under your tongue. It will absorb straight through the mouth mucosa and takes only minutes to work. And this could be used for breakthrough anxiousness, real attacks, and also for kids. No? So that's it from me. Thank you all for listening. I hope this was of value to you. I would like to also thank our retail partners who have helped bring attention to this topic. And stay tuned, I will start answering your questions in just a few seconds.